Testosterone wasn't always controversial. It wasn't always feared, and it definitely wasn't always misunderstood. In fact, when testosterone was first discovered, it was seen as one of the most promising breakthroughs in modern medicine. So how did we go from miracle hormone to something people are afraid to even talk about? Section 1, the discovery era, the birth of testosterone. In order to understand fully everything that we're going to discuss in this video, we need to understand where testosterone came from. And let's go all the way back to the 1800s with a gentleman named Arnold Adolf Berthold, who basically took castrated roosters and put testicles back in the roosters, and he started to notice that male behaviors and sexual characteristics started to come back. And this is what led other individuals to kind of experiment with this moving forward. Fast forward to 1889. Charles Edward Brown Sequard, known for his Brown Sequard elixir, which was crushed dog and guinea pig testicles, was thought to bring back vitality, strength, and all male characteristics by using this item. Basically, the public was incredibly fascinated and kind of bought into a lot of these things. And if you think back, there's a lot of snake oil around this time. But the experiment was largely placebo, offered really no benefit, and was mostly all hype. 1935, testosterone was finally isolated by a man named Ernst Lacker. And in 1939, the Nobel Prize in Chemistry was awarded to Adolf Berthinand and Leopold Ruzicka for isolating testosterone, amongst a few other hormones at that time. This began the modern era and the dawn of testosterone for clinical use. There was a lot of optimism around this time due to what the hormones could treat. Hypogonadism, delayed puberty, muscle wasting, anemia of chronic disease, multiple things could be used for treatment. It was almost as pronounced as insulin was when we first created insulin to treat diabetes. Section 2, the performance era, when performance changed everything. This is the time frame, notably in the 50s, 60s, and 70s, when testosterone basically became widespread use for a performance enhancer in sports, which drove competitive advantages, and it also led to the banning by the International Olympic Committee from using testosterone in sport. This later, down the road, led to the Anabolic Control Act of 1990 in the United States, which basically took testosterone and made it a controlled substance. We'll talk more about that later. But during this time frame was when testosterone was really sort of heavily used in sports, bodybuilding, powerlifting, you name it, to gain a competitive advantage. During this time frame as well, numerous other anabolics were also born from here, notably Dianabol in 1958, which really changed the bodybuilding and performance landscape. This is also when public perception slightly started to change, notably for the performance-enhancing effects that testosterone was providing. Testosterone isn't necessarily the problem. Its misuse changed the narrative of what we thought was normal. Section 3, the fear era, when testosterone became the villain. We all know when this happened. It's basically around the 80s and 90s when testosterone became scrutinized for its massive use for performance enhancing, notably in sports. We can pin this mostly on the 1988 Olympics when Ben Johnson beat Carl Lewis, dethroning him from his prior gold medals, and then tested positive for stanozolol, of which he was stripped and his gold medal given to Carl Lewis. In 1990, Congress had a hearing on testosterone and performance-enhancing drugs, which ultimately, against expert testimony, led to the moving of testosterone from a regular, normal thing that doctors could prescribe and doctors could use to treat disease into a controlled substance, which did put it out of reach for most everybody. But we know what happens via prohibition when you move something out of reach, thus begets an underground market for pretty much anything. And that sort of was where most of that was created, around that time frame. But also during this time frame, we have the media coming in and heavily scrutinizing steroid use. Think back to wrestling, think back to American Gladiators, where steroid use was questioned. And I can even remember Hulk Hogan going on Arsenio Hall saying that he had never used steroids before. We all knew that he used steroids. But public perception was everything back then. They had to defend themselves against saying, hey, we don't use steroids, because steroids were trying to be put into a negative light. And when we use the term steroids, we're basically referring to testosterone. Because of this media frenzy, because of this public perception turning sour, and all of the steroid scandals sort of leading into this, there was also some pretty terrible published data of some early studies that made testosterone look like it was going to create massive heart attacks, strokes, all sorts of negative things, which ended up being really terrible studies to begin with. But nevertheless, it's stuck, and that's what beget the reason why everybody thinks that testosterone is bad, at least from a medical standpoint. Because of this and the increased regulatory scrutiny, testosterone sort of fell off as a medical therapy. The fear-based messaging clips had worked, and public perceptions changed. This really made it hard from a medical standpoint to really look at testosterone, because even the medical community was sort of turning against it. Section 4, the modern era. The reevaluation of testosterone. And this is where modern science clearly enters the picture. We have increasing research into hormone health, growing recognition of low testosterone in men, albeit probably predatory from androgel, lifestyles affecting hormone levels, and renewed interest in testosterone therapy. If we kind of look back at the early 2000s, we all know the low T ads that were there. And this was clearly done, not really because en masse men had low testosterone, but clearly as a marketing tactic to get androgel kind of pushed, or that discussion had for men that thought they had low testosterone. Kind of after that frenzy died, low testosterone sort of went on the wayside, and it's really started to resurge in the recent past 5-6 years, just before COVID hit, to where it's really starting to become more of a prominent issue. And this is where we're starting to look at more of the testosterone related data, not because of fixing necessarily symptoms that men have, which it will do that: fatigue, depression, loss of libido, loss of muscle mass, decreased exercise capacity, low motivation, low drive, you name it. Yes, if you have a hypogonadal male, it absolutely will fix that. But beyond that, what happens once those symptoms are better? What happens once we get testosterone as being more than just a subjective marker for improving your health? What if it's an objective marker as well? And this is where most of the research is starting to trend. We're starting to see research that really looks into it as a metabolic improver and an overall improver for health, because it can improve cholesterol, it can improve blood pressure, it can improve overall body composition and decreased visceral fat mass, which we know directly relates to an all-cause mortality increase. We know that estradiol is benefiting the heart and its reduction in cardiovascular disease, as this study was just done in women in 2024. It has the same effect on men. So if men have low testosterone and we get our estradiol from testosterone, could we theoretically have the same benefits? Probably. There's more data that's coming on that, and I hope to see this come out in the future. But as of right now, this is really where we're starting to shift. I like to paint the picture of, if we start to see chronic disease develop in individuals, for most men, that's in their late 40s and early 50s. And what I mean by this is, you go to the doctor and, hey, you have high blood pressure, or hey, I have high cholesterol, or hey, you're kind of overweight, you should probably lose that. Never mind that you try to go to the gym and you just have no desire to do it, and it's very challenging for you to do that. Is it really that you don't have that desire, or is that motivation not there because your testosterone is low and it hasn't been corrected? Because once corrected, those things are easily achievable. So we have to stop thinking about it in this light of just symptom management only, because there is also this other health component. We know that research has shown that the average testosterone levels in men have declined over multiple decades. I don't really know what testosterone looked like relative to mostly the 1970s, which was when most of the cohorted data came out on testosterone. Sure, we knew about it. We talked about that earlier. We've known about it since 1935, essentially, and its prominence in moving forward. But we didn't really start cohorting data en masse until the 1970s. So prior to this, I don't really have reliable data to show really what men's testosterone levels were en masse. We can go back a little bit before that, but there's really no large cohorts of data. And these large cohorts of data are largely what's influenced our reference ranges nowadays. And we do know they've been declining en masse, roughly 3 to 5% per decade since the 1970s. Section 5, the cultural fallout. This is basically where the cultural stigma still exists today from everything that was created before it as to why people are afraid of testosterone therapy. Public fear, doctors still kind of not on board, despite the decades of research that's coming says that it's safe. The chronic look at that testosterone's overprescribed or overused, despite what I see in my clinic as nothing short of a miracle to get people back on track with their life and to live their happiest and healthiest life, not to mention stave off chronic disease. But because of this is where we're at. And misinformation spreads faster than science, unfortunately. Providers often lack the training in hormone optimization. I see it every day. I recently just went and taught first-year medical residents a lecture on testosterone therapy. And it's pretty clear none of this stuff is really taught aside from what the hormone is in medical school. And that's fine. I don't expect them to be masters of this, but what I do expect is to have an open mind and not be closed-minded about what this therapy can do. And in our vision is to really make sure that we can kind of look at it as something that can improve health rather than just fix symptoms. It does both, but we have to look at it as doing both. So hopefully, potentially in the future, we can sort of look at what testosterone can be for patients, but we're kind of working uphill because we're not just dealing with a hormone problem, we're dealing with a history problem. And hopefully we can resolve that. The big takeaway. Testosterone didn't become controversial because it stopped working. It became controversial because people misunderstood how to use it. The real story of testosterone isn't about danger. It's about misunderstanding. If we want to move forward in medicine, we have to understand where we came from, because the history of testosterone isn't just science. It's a story of perception, fear, misuse, and rediscovery. And today, we're still living inside of that story.